Hello, this is Dr. Richard Fleming. Today is August 2nd, 2020. We have officially begun the 8th month of the COVID-19 pandemic. Today, I am officially calling for a moratorium on PCR testing in drive-through centers throughout the United States. This practice of culturing people for COVID-19 and waiting for several days to get results back without the initiation of treatment in those who are symptomatic and require treatment has been an expenditure of resources that can be put to better use at this point in time, given the need for our supplies and medical personnel. The standard model of medical practice has been for a physician to see a patient and make a determination of when a test is indicated, and based upon the interpretation by the physician of the patient's clinical symptoms, whether treatment should be initiated immediately to prevent further problems from any infection or any other disease. The use of the McDonald's fast drive-through testing for PCR does not provide that. Instead, what it provides are ever-increasing numbers that are confused and contaminated by lack of information about people who are being tested 2, 3, 4 times in a row, and it provides no information on the severity of the illness or what the appropriate treatment is. PCR testing should be restricted to the confines of where a physician is able to assess the patient and make a determination of, one, whether PCR testing should be done, and number two, whether treatment should be initiated immediately. There is no systematic approach to the testing and treatment of COVID-19 8 months into this pandemic. Please stay with me throughout the majority of this week when I will reveal a testing and treatment sequence that takes us from the point of time of initial symptoms and initiation of treatment, through initial testing, through further treatments that are required once hospitalization is necessary for people that are not breathing as well as they should, and for individuals who are having an inflammothrombotic response, the development of inflammation and blood clots due to the disease, and what specific treatments then need to be added to address that. Again, we'll be releasing this throughout the remainder of the week, but today, on the 2nd of August, I am officially calling for a moratorium on drive-through PCR testing because it is depleting our resources, time, manpower, and providing no useful information helpful in the treatment of those who need our attention, who are suffering from the consequences of the response to the virus and need to be hospitalized and or treated long before the need for hospitalization. Thank you.